Hi everyone, I'm Isabel O'Brien and you're listening to episode 3 of our special mini season. Today, I'm delighted to share a conversation that I had with Hanna Svanbäck, who is the Executive Director for Neuroscience across the UK, Ireland and the Nordics at Eli Lilly. Hanna brings over 15 years of experience to her role at Lilly and now leads the company's neuroscience efforts across 3 key markets. With a background in genomics and biotechnology, she is passionate about driving scientific innovation and finding smarter ways to support patients living with neurological conditions. In this episode, we talk about her career journey and what drew her to neuroscience, how different healthcare systems are approaching Alzheimer's, the rapid progress being made in early detection and biomarkers within the same disease, and what the next decade of innovation could look like in Alzheimer's, not just in the lab, but in clinical trials and patient engagement too. But without further ado, let's get into it. Okay, so Hanna, before we get into the main meat of the topic today, I'd love for our listeners to learn a little bit more about you. So you've been at Eli Lilly for over 15 years. And I'd be keen to know kind of what drew you into the field of neuroscience and what has kept you really passionate about it throughout your career.
Well, to be honest, I've always been fascinated by the complexity of the human brain. It's a very complex organ. I did start my journey at Lilly actually in clinical trials in neuroscience. So I've always been drawn to this area. So that's one, the genuine interest for this area. But there's also, like, for many of my team members and also probably listeners to this podcast, I do have a personal connection to dementia as well. And of course, that gives you a deep sense of purpose as well. But what it really does, it's also exposed you to what is currently available in terms of care and treatment today. And I'm really convinced that there is more that we can do for these patients. And if I just reflect on my family, and in my family, even though I work in this area, we actually deflected the early symptoms of the disease. And it took quite some time before we sought help. And even when we did that, it felt like it took an eternity to get a diagnosis and even longer to get a specific diagnosis. And it wasn't until we got that diagnosis that we could actually inform ourselves about how we could best support our family member, and also that we can seek the optimal treatment and care for our family members. So it is very important. And I know firsthand what it is to deal with dementia. And I would say that these personal experiences, they really create a deeper sense of purpose and dedication. And that's, of course, a big part of what keeps me passionate. In more general terms, at Lilly, that sense of purpose have really shaped decades of commitment. So for more than 30 years, we have been driving scientific progress in Alzheimer's disease. And we have invested more than $8 billion globally in research and development. And we are fully committed to delivering innovation that can really pave the way for a better future for patients that are affected by Alzheimer's disease. And we know that so many are affected, which means that every breakthrough really has the potential to change millions of lives. So it's quite easy to be passionate about that, to be honest.
Yes, I completely understand that. And thank you for sharing that additional context as to why it is so personally important to you. I think you're right. So many people listening to this will have been touched by dementia. And I imagine that does power you forward all the more in the work that you do. Talking of the work that you do, so I understand that you lead neuroscience across the UK, Ireland and the Nordics, countries which I guess from the outside seem to approach healthcare in quite different ways at times. Their societies are quite different. So from your perspective, how different are these landscapes in reality that you're working in? And is there anything that you actually think they could learn from each other when it comes to neuroscience and Alzheimer's?
Yeah, absolutely. I do have the privilege to work across many countries, which is very interesting because each system, as you say, has its strengths. For example, if we look at the UK, we have an independent regulatory agency, the Medicines and Healthcare Product Regulatory Agency, MHRA, and that agency allows then that independence, I would say, allows agility and also flexibility. Whilst if you look at the Nordic countries, and I would say especially Sweden, the use of biomarkers to diagnose Alzheimer's disease in secondary care is extremely high. And this means that Swedish patients have a higher likelihood of having that specific diagnosis, an accurate diagnosis, to really understand the underlying disease pathology, like what is causing their condition. But also, I mean, all countries that that I have the privilege of working in really face the same challenges, and it is to get a timely diagnosis early enough, and also to make sure that we're appropriately staffed. The workforce and system capacity is a real challenge across all countries, and also to make sure that we have equitable access to care and treatments across the country. So we're facing similar challenges, but the opportunities really lies within the shared learnings across borders, so that we can make sure that we can create more connected pathways from early science to patient care.
Yeah, fascinating to hear, specifically that point on Sweden and how they work with biomarkers to achieve earlier diagnosis. That definitely seems like something other countries could learn from. Next, I want to touch on, you touched on it a little bit earlier, that neuroscience is quite a complex area. I think there's still many mysteries around brain biology, which can make, drug targets harder to validate, trials sometimes more likely to fail. So given all of that, how do you keep yourself and your teams motivated through the inevitable bumps along the way? I always find this a really interesting point to ask people in the industry.
Yeah, it is. And well, to put it simply, we're in it for the long run. I mean, most of my team members have been working in this space for a very long time. They know that it takes time, and they also know that setbacks are actually part of the journey to make progress. It's a really resilient team. I'm very proud of them. And what also is very clear that most of them has a deep personal connection to Alzheimer's disease. And we are sharing personal stories, to be completely honest, between each other. And even though it's heartbreaking to do that, it's also extremely motivating because it reminds us that there is more that we can do for these patients. And we know, because we know the stats and we have the data. So we know that far from all patients are actually receiving a diagnosis today. And even if they do, 1 out of 5, and actually a bit more than that, are being misdiagnosed. And that means that you can be diagnosed with Alzheimer's disease without actually having Alzheimer's disease. And I think just knowing that makes it, we really need to do something about this. And that's why, along with driving this scientific research and progress, we are really working on other initiatives as well to create awareness around how important it is to get an early and accurate diagnosis to ensure that patients today can access best supportive care and also access clinical trials and plan for the future. So knowing that we can do something today is actually extremely motivating.
Keeps coming back to that personal connection and how it really can drive progress forward. So yeah, thank you for sharing that, Hanna. I can see why that's really important. And that wraps up part 1. Thank you for listening. Join us for part 2, where we will continue the discussion.